My involvement with the Clinical Training Network started probably in 2012 and I was invited on to the governing committee. At that stage it was a steering committee which had very different responsibilities in terms of finances. So we evolved during that time and became a governing committee, and I then took on the chair role of that committee. The achievements of the West Australian Clinical Training Network have been both very clear in terms of the resources that it has offered into WA in terms of the training for clinical supervision, the simulation learning events that have occurred, the resources that have been purchased for simulation learning, and a whole range of things that we can see at the end of the day in terms of product. But I think what I'm particularly proud of is the relationships that have been built between the education sector and the health providers. And that's across government, across private and not-for-profit, small agencies, large agencies, and particularly in the non-traditional areas that we have been able to encourage and facilitate clinical placements in. So aged care, primary care, mental health, rural and remote, and in Aboriginal services. They are key areas into the future where we need a health workforce, and we need to train them up to be able to deliver care in those areas. I think the West Australian Clinical Training Network is at a transition point, and we really are at the beginning of a new era where the people around the table are there because they want to be. Previously, the Commonwealth Department had dictated who was going to be a member of the Clinical Training Network Governing Council. But now people will be invited, and they will be there because they want to collaborate, they want to share their resources, and because they're passionate about the work that they're doing, both in terms of delivering health services, but also educating that future workforce that we need to be attending to. Collaboration is critical when you bring agencies and individuals together. They need to have a shared vision in terms of what it is that they want to achieve, but they need to come to the table prepared to share their money and their power. And that, for me, is a really good definition of collaboration. And you feel the difference when you're around a table and people say, well, actually, I can do this, and then other people add to that, rather than sitting back and just coordinating at a distance. One of the other highlights, I think, for the West Australian Clinical Training Network has been that it has been interprofessional. So all of the professions have come together and now see many more opportunities where they can educate and train their professions collectively. And when you think about it, that's how we deliver health. So it's really important that our students have that very early in their career. And that's being encouraged, across the training institutions and also in our health services. My sense for the future is that it's very evident that if we're not collaborating, if we're not building the relationships across the sectors, that we will return to the very siloed focus that we once had. It's imperative that we don't do that. And I think the West Australian Primary Health Alliance has provided us an opportunity for us to gather and to continue with those relationships across sector and into the future. While the funding from the Commonwealth has ceased for the West Australian Clinical Training Network, there's actually much work that will continue. Firstly, the Greater Northern Regional Training Network, which has been established to address the maldistribution of workforce across the top end of Australia, a collaboration between Western Australia, Queensland and the Northern Territory. That will continue to be funded, and I think speaks volumes of the work that they have already achieved. The Immersive Simulation Learning Committee will continue to meet and will continue to plan for the activities and the resources that are required in that space. It's critical that we begin to enhance the training of our students through simulation methods. One of the other things that I want to speak of with the West Australian Clinical Training Network is the support that has been given to it from the very top of our institutions. So from the Director General, the Pro-Vice Chancellors at the universities, the Managing Directors of our vocational and employment and training networks, from the providers of health, private, public, not-for-profit. They have all engaged in the processes. And so I am filled with hope that the processes will continue. The collaboration and the relationships are well established, and we will be able to continue to deliver the training environments that we need for our future health workforce. One of the reasons that the WA Clinical Training Network has been successful is that we very overtly discussed the underlying principles in which we were going to meet. We were clear that we needed to be respectful. We were clear that collaboration meant turning up to the table and sharing your resources and power. We were very clear about the values that we expected around our table. And those conversations, I think, will continue into the future.